News about putting a pause on the J&J vaccine has raised some concerns, not only for those who have received it, but also for those who haven't signed up for their vaccine yet.
Dr. Ilan Shapiro is the medical director of health, education, and wellness at AltaMed's Health Services, and he joins us now to help give us some perspective on this and today's news. So, Dr. Shapiro, thanks so much for joining us. We appreciate it. So, can you please put this into context for us, and how rare are these adverse side effects?
Well, if we are saying that it's 6 out of almost 7 million doses that we have given, it's a single dose, and we have actually vaccinated 7 million people, and we're having only 6 cases. This is bad to have those cases, but if you put it on the context, it's still below the normal threshold that we're seeing, this type of thrombosis in our community. Then I still feel amazingly safe and secure that, we have not only one vaccine, but we also have Moderna and Pfizer as other tools to protect ourselves and communities against COVID-19.
Well, let's talk about it, because obviously, we're talking about having somewhat of a shortage of these vaccines, and then the people who did receive the J&J vaccine, if they're now looking at this news, what are some of the symptoms that they need to look out for, and what should they do if they do have any concerns?
Correct. One of the things that we're seeing is these cases happen a couple of weeks after the shot. It was 1 to 3 weeks afterwards. And whenever you have amazing headache that is horrible, you're having shortness of breath, you have a lot of pressure in your chest, or actually abdominal pain that are horrible, those are 3 or 4 things that you need to be checking for and making sure that you have those reported. And of course, seek medical attention. But it's very important to understand that actually, Johnson & Johnson vaccine is only 4% of all the shots that we're giving here in California. Then at least we know that we have enough vaccines to continue vaccinating our entire population here in our state.
Well, that is certainly reassuring. Again,
I'm just curious, so if it's been 2 or 3 weeks since you've had the shot, you're out of the woods? I'm just curious about that.
Right now, the information that we have is the cases have been actually between that 1st and 3rd week. And it's very important that, if you're having symptoms, report them. We have not had any related or timeline with other vaccines after 4 weeks. Then that's good news for everybody. And it's very important to understand that we need to continue vaccinating ourselves in order to shut down this COVID-19 pandemic that has been hurting our communities very, very hard.
Absolutely, Dr. Shapiro. Of course, a lot of people even say they'd still get the J&J vaccine because they want this pandemic to end. So certainly thank you very much. Again, Dr. Ilan Shapiro with the Medical Director of Health, Education, and Wellness at AltaMed Health Services. We appreciate your insight today.
Well,
a pleasure.
Thank you.